Give me 1 sec.
Yeah. Somebody's got that noise coming.
Yes, you're on. Give me 1 sec, Vijendra ji, give me 1 sec. 1 sec, give me 1 sec. Yes, Vijendra ji, you can talk now.
Okay, namaste and welcome to Asha family for our regular fortnightly health talks. Asha Australia Foundation is a non-profit charity organization and mainly run by volunteers, which we are very grateful to them who are spending countless hours these days to support our seniors, educate them, and assist them in any way they can. So we have daily Bollywood music, which is recorded by our seniors. You can tap onto that. Weekly, we got on Monday yoga 4 to 5 o'clock, chair yoga for the seniors, and on Fridays we got Antashri to sing along. Apart from that, we have a lot of other things coming up. So please try to become a member, volunteer, join us, and let's help you to help you. We are very grateful and we welcome Dr. Kawaljeet Singh, who has taken time to come and talk to us. And we are grateful to all of you on a Saturday afternoon, come and join. So please, I will request Dr. Sundar, who is one of our directors, to welcome Dr. Kawaljeet. Thank you, Dr. Kawaljeet Singh, and thank you, Dr. Sundar.
Good afternoon, Dr. Kanwal Singh. Good afternoon, ASHA members and seniors. Thank you for listening to our ASHA program today, the prevention of falls in elderly today. Dr. Kanwal Singh will be talking about it. Dr. Kanwal Singh, he did his medicine in India and came trained in Westmead Hospital. He's a geriatrician and a physician looking after aged care people there. Elderly people, aged care, elderly people there. His main interests are include falls and balance in elderly people and osteoporosis. Gone.
Dr. Kawaljeet Singh.
Yeah. Thank you, Dr. Kawaljeet Singh.
Yeah. Thank you, Gugolji.
I could hear. I think. Thank you, Dr. Kanwal Singh. We'll follow your lectures now.
Thank you, Dr. Sundar. Thanks for introducing myself, and thanks for Asha Foundation to invite me to discuss about a very important topic today, which I've been dealing for last nearly 10 years. And as a geriatrician, I look after seniors in the community. And basically, one of my expertise is dealing with the falls. And the question is why falls is important. And until or unless we sustain a fall, we do not realize how important it is to address this issue. And majority of the time, it just comes as a surprise to the seniors. They don't even realize that they're going to fall, but they end up on a floor and end up with a major injury. So the question is, why is it important and why does it happen? So today in my talk, I'll be discussing about the reasons, the factors that lead on to the falls, what we do as a geriatricians, and what are the recommendations to prevent the falls and the related issues like osteoporosis. So once again, thank you very much for inviting me over here. Now, as I said, why falls are important. And one of the major issues with the falls is people sustain major injuries after fall. Like anybody can fall, from a little child up to 100-year-old. But when we grow older, the chances of having injury are more because our bones are more brittle. And on top of that, our muscles are getting weak. So people can have injuries can vary from the minor injuries up to very serious injuries like head injuries. And I've seen people dying because of head injuries related to the fall. Then the other major issue that happens with the fall, especially from injury point of view, is fracture of hip. Now, it's one of the common causes of disability and death in an older person. So people who have got osteoporosis, which is thinning of the bone, which is very common in older population, when they have a fall, the chances of having hip fracture are very high. And even though with a good management these days, with a good surgical operations, procedures, and rehabilitation programs, a lot of people can get back onto their feet, but they can't enjoy the same independence which they were doing before. So that's why it's very important to address this issue. The other injuries that can happen can be the fractures in the back, in the spine. And these fractures can be really painful and can have a detrimental effect on person's quality of life. So people can't enjoy their walks, people can't sit for a long time because of the pain which they can have from the back. The other thing that it affects is the independence of the person. So I've seen many elderly people ending up in a nursing homes because of the falls, especially with the recurrent falls, or if they sustain a hip fracture or sustain a head injury. They end up in the nursing home for the rest of their life, and it significantly affects the quality of life of that person. And it definitely affects the mobility of the person as well. Like, if the person is frail and their muscle mass is less, which I will discuss in a few minutes, it can affect their mobility, their independence. Like, they have to utilize walking aids. And even with the walking aids, people can still fall. And one of the major issues which majority of the doctors do not discuss or do not see is mental health issues related with the fall. A lot of time people go into a depression phase because they lose their independence. There's a fear of falls. People are so scared. I looked after a 94-year-old lady in Campbelltown area a long time ago. It was a wonderful lady who had two or three falls. And after that, she was so scared, she wouldn't come out of her house. She didn't have an immediate family. She was 94. Her grandson used to live in a different state. So she didn't have any other help. Luckily, she belonged to Veteran Affairs in Australia. So she was getting some sort of community help in that way. But there wasn't any sort of direct help. And the lady wasn't getting out of her house because she was so scared that she's going to fall. And she was basically avoiding going to the toilet as well, and wearing pads to prevent any sort of fall. And it was like, it took me nearly 6 months to reassure that lady, to put her into rehabilitation program, to get her back on her feet. And the good thing was that after getting into an exercise program, after seeing a dietitian for extra supplements, she improved. And that fear of fall actually went away. And the lady, I kept on seeing her till she was 97, and she was still walking independently. And she was coming to my clinic by herself. So it can have a major impact on person's mental health. And I've seen a lot of people ending up in nursing home because they are so scared that they don't want to stand up. And they're scared that they're going to fall. Now, the other thing is it can lead on to a lot of financial burden on a resident or on the person himself and onto the hospital system as well, which we normally don't discuss. But I think it's an important thing as well, because if I have a fall and I end up in a nursing home, there is a cost involved. If I have a fall, there's rehabilitation, and again, there can be a cost involved with a physiotherapist. My own mother she was visiting me from India long time ago. At that time, my eldest daughter was 6 months old. And basically what happened was we had a tiled floor uh, at our home. And unfortunately, there was a spillage of water and she slipped, broke her ankle, and wasn't able to walk for at least 6 to 7 weeks, and then required a rehabilitation for another 6 to 7 weeks. And she, even though she had private health cover at that time from India, but they weren't able to fully compensate the cost. So I actually ended up paying through my own pocket. So I've got a first-hand experience with the burden that can be involved with the falls and fractures, even though in Australia we've got a Medicare system. But again, once people are discharged from the hospital, they may need a rehabilitation for some time and may require a private physiotherapist, even though we're running a lot of public health funded physiotherapy programs nowadays. So the next thing is what maintains our balance? Like, why doesn't a 40-year-old or a 50-year-old falls that often as compared to a 70-year-old or 80-year-old or a 90-year-old? Now, just going back to simple basic principles, to maintain our balance, we need a muscle strength. We need good, strong muscles that can maintain our balance. Then we need our ears. In our ears, we have middle ear, where there is a fluid in the ear. And that basically helps maintaining our balance. Now, when we grow older, what happens is our muscles start getting weaker because we are not doing that much exercises. Might be because of arthritis, might be because of our lifestyle, might be because the testosterone and hormones are getting less in the body. So our muscles are getting wasted. And on top of that, we start having ear problems. The most common one is benign positional vertigo. People start having deafness in the ears as well. And that can lead on to the balance issues as well. Now, there are other factors that basically help maintaining balance, which is joints. Now, when we grow older, we start getting osteoarthritis, which is like, a most common arthritis in seniors. And because our knees can get locked easily because of the arthritis or because of the pain, like, when I'm walking, if I get a pain in my hip or in my knee, may affect my balance and I may fall down. Sometimes people come and say that, oh, my leg gave way. It's because the muscle is weak or because of the arthritis. And then there are other main things that basically contribute to the falls or maintaining the balance, which is an eyesight and peripheral vision. Now, when we grow older, people develop cataracts in eyes, people develop macular degeneration, which is a condition of the eye in older people where they lose their eyesight. And people can actually misjudge the step, or they may not be able to find the tripping point and they actually fall down because of that. And it's again one of the common factors which we actually see in our clinic regularly. The other thing is bifocal glasses, which is again, like, a lot of optometrists prescribe bifocal glasses. Bifocal glasses is like, where you can actually see far and you can read in the same glass, with the same glasses, with the same lens. Now, there's a proven evidence, a whole lot of literature on this thing that basically explains that when we use bifocal glasses, the chances of tripping over or falling are more, because the glasses, especially the reading portion of the glass, because our reading distance is probably less than, it's around quarter a meter. And when we are standing up with the bifocal glasses and we look down, that distance actually increases by roughly 1.5 meter or more. And that basically leads on to the misjudgment, and people can trip over on the footpath or on the stairs. And then the other body parts that actually are involved in maintaining balance is spinal cord. Now, I normally explain it to my patients in a clinic that when we stand up, our feet send signal to the brain through our spinal cord. And if there is an issue with our spinal cord, which can happen quite often with some vitamin deficiencies, the signal does not get transmitted to the brain. So our brain is not aware of the situation of our feet. So let's say if I am standing in my garden, it's an uneven surface, my brain wouldn't be receiving that information. And then there is another thing that can affect that information. It's called peripheral nerve involvement. And it's again, like, the signal is transmitted from the peripheral nerves, the nerves of our feet, to our spinal cord, and through the spinal cord, it goes to the brain. So if the nerves in the feet are involved, there are multiple reasons for that, starting from a simple injury to vitamin deficiencies to diabetes, which is again very prevalent in our Indian community. People can have recurrent falls, and their balance can get affected as well. Now, getting back to the reasons for the fall, there are multiple reasons for the falls. And I think it's important for a person to know those reasons so that those can be avoided. Your GP, your specialist may be able to find few factors and advise you. But if you are aware of your whole situation, it's a lot easier to prevent falls. And majority of the falls are avoidable. If we have to, majority of the fall, as I said, they are avoidable. Now, the most common reasons for the falls include medical conditions. Now, as I said, when people grow older, they develop a condition called sarcopenia. Sarcopenia is a wastage of muscles. It's very common. And that's why you see, even though they might be having a lot of fat, they might be looking a bit bigger, but still the muscle volume shrinks as we grow older, because our growth hormone is less, our testosterone level is less, our hormones that basically control our body mass are less. We are not doing that much exercises, probably because we're getting tired, probably because of arthritis, and all these things that lead to the muscle wasting and falls. And the medical reasons, then there are cognitive issues. People who develop dementia, they are at high risk of falls. Then there are medications that lead on to falls, which I'll discuss these factors in details in a few minutes. Then I mentioned about ears and eyes pathology. And then the other important factor is alcohol, which most of the time people, especially doctors, forget to ask when we take history. And it is one of the significant factors, especially when you are 80-year-old and you've got so many other factors on top of that. I'm not saying that you shouldn't be drinking. What I'm saying is that sometimes the amount which you were able to tolerate 20 years ago or 10 years ago your body may not be able to tolerate that amount. So it's all about putting everything in the same basket and trying to find out how can we address the falls. Now, let's talk about the medical reasons for the falls. Now, the most common medical reasons which we see in our clinics is Parkinson's disease. Now, if you guys are not aware of Parkinson's, it's a disease where people start having shakes in the hands, tremors in the hands, and it also affects the gait of the person. And in early phases of this disease, we have got fantastic medications these days, which can be used to prevent, to improve the mobility and to improve the quality of life, and it prevents falls as well. The other medical conditions that can lead on to falls is arthritis. As I mentioned, people have bone on bone in a joint, and it can lead on to falls because of the pain or because of the mechanical factors. Now, we discussed about peripheral neuropathies. Peripheral nerves can easily get involved. For example, if somebody has a long-standing history of diabetes, uh, their nerves in the feet can get affected, and they get these symptoms of numbness or tingling in their feet. People who have got thyroid issues, it can lead on to peripheral neuropathies as well. There are multiple other reasons for peripheral neuropathies as well. Like, for example, vitamin B12 deficiency, which is a very common deficiency in vegetarian diet, especially because majority of our Indians are vegetarian, and it can lead on to peripheral neuropathies. Then people can have a stroke. Sometime it may not be an obvious stroke that can lead on to the falls. It may be just small vessel disease. Now, what is small vessel disease? Our brain has got brain get blood supply through different arteries, through different blood vessels. Now, some blood vessels are big, and some blood vessels are very tiny, very small. Now, when we get a stroke, we get a clot in a bigger artery or a bigger blood vessel, and it becomes very obvious. People get paralysis of their arm or their legs, and they're not able to walk. They've got difficulty with speech. They've got difficulty with swallowing. A whole lot of symptoms can happen. But then there is a small vessel disease, which can happen in people who have cardiovascular risk factors, and it is again very common in our Indian population. We see it very often in our clinic. And in small vessel disease, what happens is the tiny little blood vessels, they get clogged over a period of time. It may take, like, it doesn't happen overnight. The clot in a bigger artery can happen like this within seconds. People can get a major stroke. But the small vessel disease, it takes ages. It can take up to 10 years, 15 years before you see those sort of symptoms. And people can have memory issues because of small vessel disease. People can have balance issues because of the small vessel disease. And unfortunately, once you develop small vessel disease, it is very hard to treat it. And that's why we basically say that the younger population, especially in their 40s or in the 50s, they should be looking after themselves, because they are the one, they are growing older as well. And so that means that improving the lifestyle, doing regular exercises, eating less fatty food, a whole lot of cardiovascular risk factor improvement. Now, the other things I mentioned is dementia. Dementia, people, what happened in dementia? Again, this is a major topic, which when I was in India, when I was getting trained in India, we could hardly see any dementia patients over there. And I was surprised, why aren't we seeing dementia patients? And when I came to Australia, a whole lot of dementia population. And I think one of the factor was that in India, the lifespan is not that much. So people die relatively younger as compared to Australian population. It's probably because of their diet, it's probably because of their lifestyle, it's probably because of their medical conditions, underlying medical conditions. But people in Australia live longer, and that's why they are more prone to develop dementia as compared to Indian population. Now, and what happened in dementia is there are different forms of dementia, but the three common forms of dementia: Alzheimer's dementia, where there's a shrinkage of brain. It happens over years as well, and people start losing their balance and falling. Again, there is a Lewy body dementia, where people again get symptoms like Parkinson's or tremors in the hands, and they can fall. And then there is a vascular dementia, where there is a small vessel disease, as I mentioned, that can lead on to balance problems as well. Now, the other important factor that can lead on to the falls, and it is easily avoidable. And believe me, majority of the time I actually address this factor, and it is medications. Now, what happens is there are a number of medications that can lead on to falls, and how they do that, they can do through the various ways, but majority of them, they actually act on the brain and affect the balance. So for example, most commonly we use antihypertensives to control our blood pressure. And what it does is, because our brain needs perfusion, our brain needs blood, and brain needs oxygen through the blood. And if we drop the blood pressure too quickly or too low, it can lead on to falls, because when we stand up, for that particular moment, for that few minutes, our brain does not get enough oxygen and we fall. Then there are other medications like cholesterol tablets. Cholesterol tablets like statins, atorvastatin, it's very commonly used. It is a good tablet. I'm not saying that we should be stopping in all of them, all of the patients. But after the age of 85, I tend to stop this medication, especially cholesterol. High cholesterol does not cause much damage in population above the age of 85. But in younger population, it can lead on to heart attacks in future. But at the same time, it can lead on to the weakness of the muscles in the leg, and people can fall. And then there are antidepressants. The medications that are used in depression are very commonly used. It can act on the brain, can lead on to falls as well. And then we commonly use cold and flu medications like antihistamines. They can lead on to falls as well, because they cause drowsiness. And from drowsiness, I remember sleeping tablets. A lot of people use sleeping tablet at nighttime. Now it acts like it acts like alcohol. It's the same sort of mechanism. It acts on the brain, causes drowsiness, cause a bit of hangover. When people walk to go to the toilet at nighttime, they fall. So it is very important to talk to the doctor to see, like, if the medications can be adjusted. And sometimes people don't even realize that, like, because it takes ages for them to go on all these medications, and it becomes harder because they are so reliant on these tablets. It becomes harder for doctors to take them off. But I think sometimes we have to bite the bullet, and we have to take people off the tablets, especially unnecessary tablets. Now, the other important risk factor which we actually see in day-to-day life, and it is easily avoidable and preventable, is environmental risk factor. Now, like, people have wires hanging around inside the home, especially with the phone charging wires, like, people have got heaters and all that stuff. So a whole lot of wires, they are trip hazards. And a lot of people, you'll be surprised, a lot of people trip over the wires. Then a lot of us have got rugs or mats inside our homes or outside the home. Like, before we enter into our house, we have got a big mat. Even I have got that mat outside as well. So I'm a bit of guilty, but we can easily trip over those mats and fall. And then there can be other environmental hazards, like, for example, in shower, a lot of people fall in shower. And it's because of the slippery floor. And a lot of injuries happen that way. Then there can be poor lighting, especially at nighttime. If I have to go to the toilet, my eyesight is already not good. My sensations of heat are already not good. My joints are getting older. My muscles are not strong. I am on antihypertensive medications, blood pressure medications. On top of that, I've taken a sleeping tablet. And if the light is poor, I would not realize that I am tripping on something. So that's why it's very important. And the other thing which majority of the time we need and we forget is rails inside the bathroom. And like, for example, having rails around the toilet seat, having rails in the shower, so that you get something to hold on to grab onto, to maintain your balance, especially when you're taking shower or you're standing up. Then improper shoes. A lot of time we see that people are wearing shoes with the laces, and they can trip over their laces as well. So, and then poor choice of mobility aid. So if somebody needs a walking frame, and instead of that, and again, like, I see it very often in my clinic, and it takes me a lot of effort to encourage people to use the proper walking aid, because a lot of my patients, they have got a hesitancy that they don't want to use a walking stick or a walking frame because they will look older, and they don't want to look older. But I believe me, like, I actually end up spending 10-15 minutes just to convince them that it is important, because if they have a fracture, they may end up in a nursing home, and we don't want that. So sometimes, like, you just have to give up that pride and ego, and just accept doctor's advice. Now, there is one very common condition which I would like to address. It's called benign positional vertigo. Now, benign positional vertigo is when our ears, especially when we grow older, it can happen in younger population as well. But when we grow older, we get floating cells, the dead cells in the fluid in our ears. And every time we turn our head, we get a spinning sensation, a vertigo. And majority of the time, it can be treated without any medication, with just simple physiotherapy maneuvers, which your GP can do that in their room as well, and you can learn yourself as well. And a lot of time, like, people develop it, and it needs to be looked into and avoided. Now, let's say you are at a high risk of falls, or you're getting falls. What to do at that time? Now, my advice would be to go and see a doctor, your GP. Like, if you feel that your balance is getting off, or if you feel that, or if you had a fall, go and see your doctor. Do not, because majority of the time, what I have seen is that a lot of my patients, they don't even tell their family, because they're scared that, like, I have a fall, I don't know, like, somebody may put me into the nursing home. So a lot of time, or they may say, oh, I just slipped, and it happens. So we should be taking falls very seriously. Even with one fall, you need to go and see your doctor, because a whole lot of physical examination and risk factors that I explained to you need to be addressed. And there are many more other medical conditions and risk factors which I haven't described because of the time restraints, that your GP or your specialist need to look into. So it's very important. And what I do in my clinic, when a person with falls present, I basically take a history, a detailed history of a person. Now, people, like, whether they lost their consciousness, whether they had a seizure, whether they had incontinence, because people have incontinence, and then they can slip on urine or feces, which is, again, it can get embarrassing for an older person. But again, it's a very common problem in seniors, and that needs to be addressed, and it can be fixed in majority of the cases. And then, like, we try to take a history of environmental factors. We do physical examination on the person to see whether it's the eyes that are getting affected, whether it's the spinal cord that is getting affected, whether it's arthritis that is causing trouble, whether it's a peripheral neuropathy. So there are a whole lot of physical examination that is done in the clinics. And then, like, we can assess the individual nerves as well. For example, I do nerve conduction studies in my rooms to see if there is any sort of if I'm worried about any particular nerve that is getting affected. Then we do gait examination. We ask people to walk to show us how their mobility is, and we look into their medications to see if we can cut down the medications, and if we can remove unnecessary medications off the list. So a whole lot of thorough assessment needs to be done. And I normally it normally takes me an hour to do whole physical assessment and examination. And if we have to do some other investigation, it can take a bit longer. But I like our philosophy is that it's better to be thorough and to rule out the risk factors rather than ignoring it. Now, we do few investigations as well, depending upon the person's medical symptoms and medical condition. But there are some investigations which I normally do on all of my patients, and that is vitamin D levels. Again, vitamin D deficiency is very common in our Indian population. Even like when I came to Australia, my vitamin D was 13. It's supposed to be 70. And from 50 to 70, it's a normal range. So basically, like, I had to take supplements myself. My mother, my father, even my wife, all are vitamin D deficient. And we had to, get a vitamin D deficiency replacement, because what happened is vitamin D is important in maintaining muscle strength, especially our pelvic muscles. And if vitamin D deficiency is there, people can fall. On top of that, vitamin D deficiency can lead on to weakness of the bones as well. It can lead on osteoporosis. So if I've got a weak bone and I fall, the chances of having fracture are more as compared to if I've got a strong bones. And vitamin D deficiency, as I said, it's very common in whole Indian population, not just in older population, but in younger population as well. So it needs to be addressed, and it can be fixed. The other thing is, other thing I do is thyroid function test and vitamin B12 deficiencies investigations, because it can lead on to peripheral neuropathy, and it can lead on to falls as well. And then sometimes we do assessment of the brain through CT scan of the brain or MRI of the brain to see if there is any sort of brain pathology that is leading on to the falls. And I also do a DEXA scan, which is a very simple scan for osteoporosis. And it hardly takes 5 to 10 minutes to get this scan done. Because if somebody has got osteoporosis, I know that I can fix it. And it can be treated easily. So it should not be ignored. So if your doctor is forgetting to do the DEXA scan, just ask them to get a scan for the bones for osteoporosis. Now, the interventions. What can be the interventions? Before we jump onto the intervention, there's another symptom which I actually forgot and I want to mention. That is actually when we stand up quickly, especially in the morning time. If we are feeling dizzy, it's because of the drop in blood pressure. And majority of the time it happens because of blood pressure tablets. But other tablets can contribute to this thing. Diabetic patients can have this drop in blood pressure because of the nature of the disease itself. And then there can be other reasons why people's blood pressure can drop. But it is a very common symptom. So if you are feeling dizzy when you stand up quickly in the morning or any time of the day, go and see your doctor, because it can lead on to the falls. And the other thing that I mentioned is incontinence. Incontinence, people forget it majority of the time, but it can be a dangerous thing as well. Especially, I've seen people falling over when they're trying to change their pads. And majority of the time, incontinence can be treated. especially if you go and see a urologist or a geriatrician who is expert in dealing with incontinence issues. Now, coming back to interventions. Now, falls intervention is it's a sort of like, holistic intervention. It's not that, okay, we fix one thing and the falls will disappear. You wouldn't get falls again. So we basically have to address all those factors which we discussed before. For example, environmental factors. So I need to make sure that my corridors are clean. They're not cluttered. I need to make sure that, like, there is no spillage of water. For example, as I said, my mother actually spilled water and actually slipped herself on that. So we need to be very careful, especially like, in these countries where we have wooden floors or tiles, especially in the new buildings, new units and new houses. So it can be quite dangerous. And also make sure that the floor in the bathroom is not slippery. You've got a proper mat in there that is a non-slip mat, and you should have some sort of rails to hold on to so that you don't trip over, you don't fall. Have proper lighting inside the house, wear proper shoes. Try to avoid bifocal glasses because bifocal glasses can lead on to falls. If you've got a cataract, get a treatment of a cataract. If you got any vitamin deficiency, for example, vitamin B12 deficiency, vitamin D deficiencies, that need to be addressed. So your GP actually need to start you on medications for that. Now, as I said, there are many medical conditions that can lead on to the falls, so they need to be treated as well. Now, apart from that, there are other things that needs to be looked into, and that is exercise, which a lot of our Indian community, especially our elderly, they are not doing it. Like, basically we think that after having a bit of dinner and having a walk around for 5-10 minutes is enough. No, that's not the exercise. You need to do a regular leg strengthening exercises. And you need to see a physiotherapist to get those sort of exercises. They're not like, I'm not asking people to start lifting weights, heavy weights, or start going to the gym. If you can go to the gym, it's good. If you can lift weights, it's good, because it basically helps strengthening the muscles. But simple exercises, for example, standing up from the chair and sitting down. So those are called half squats. So if you do it 10 times, so standing up, sitting down, standing up, sitting down, you do it 10 times and you do 3 sets of it a couple of times a day. That is a good exercise for the legs. If you hold on to the kitchen shelf and walk side by side in both directions, it's a good exercise for the pelvic floor. And if you've got a TheraBand is like a rubber band, which you can get it from a physiotherapist. And they can basically teach you how to do those exercises. And if you do that, it is good. Or sometime, like, if your legs permit, and if you're relatively younger or relatively stronger, if you can tie little ankle weights around the ankle, like not a big weight, just a tiny little weight, like for example, a half a kilo, and lift the legs up while sitting on the chair, not while standing, that basically help improving the leg strength. And so it is very important to do exercises. And the other exercises that can be done, especially if you've got a joint pains, is hydrotherapy. Go to the swimming pool in your community and walk in the hydrotherapy pool. It will basically help maintain your balance. It will also help with arthritic pain. So people get arthritic pain and then they stop walking. What it does is it basically causes weakness of the muscles because of deconditioning. So you're not using muscle, you will lose it. And because your muscles are getting weaker, the arthritis pain gets worse. So if the muscles are stronger, you will notice that arthritic pain is getting less as well. So if you go and do hydrotherapy in the pool, or if you are doing leg strengthening exercises, your pain will reduce as well. I wouldn't say that it will disappear, but at least the level of the pain will come down as well. And the other thing is it will maintain your balance for a long time. And let's say if you need a joint replacement, or if you have a fall and accidental fall, and if you are already doing exercises, all those exercises, your legs were already strong, your rehabilitation time will be less. So because your legs are already strong, uh, doctors can fix your joints, and then you can get back onto your feet straight away, just very quickly, and you can gain your independence very quickly. And then the last but not least is an osteoporosis management, as I mentioned. So osteoporosis is the thinning of the bones, which actually happens because of multiple reasons. But one of the common reasons is vitamin D deficiency, which is very common in Indian population. But when we grow older, our hormonal levels go down. And because the hormonal levels are going down, people can actually have weakness of the bones. So these can lead on to fractures as well. And it basically needs, it can be treated with simple injection and vitamin D replacement. So I'll finish my talk here, and if there are any questions, I'm more than happy to answer.
Thank you, Dr. Kavaljit. So we will open for questions. So if people can put their hand up, so and unmute themselves, and then we'll go on from there. Is there any question from the floor?
Yeah.
Padmanji, you have, yes. Thank you, Padmanji.
Thank you, Doctor. So much informative session. My question, I mean, I have quite a few questions, but one question I would like to get answered today is, you mentioned about small vessel disease.
Yes.
Especially for the youngsters. Will we get some early indications of that is being developed? You said no, it will take a bit of time. So will we get any early sign, any early warnings?
People don't get any early warning of small vessel disease until or unless that small vessel, basically until or unless they get a stroke or something. But with the small vessel disease, it is very hard. And majority of the time, we actually find it out on the CT scan of the brain. But there is no no recommendation of doing a CT scan of the brain early on to rule out any small vessel disease. But with our experience, we know that if we control the cardiovascular risk factors, we control our blood pressure, we control our sugars, we control our cholesterol, we do regular exercise, then we can actually slow down, or we can completely eliminate small vessel disease.
But there is no blood test as such to find out.
No, there is no blood test.
All right. Thank you, Doctor.
Is there anybody who's got a question, please?
Dr. Kirmal Singh, I'm here. Can you hear me?
Yes, yes.
Yeah.
Just say something about the aged care, my aged care, to some other people who are listening now. So there might be a lot of seniors listening to aged care.
Yes.
To say a few words, they should be able to access the community services, level 1, level 2, level 3, and level 5. Thank you.
Now, in Australia, we are very lucky to have the community care services. They are community-funded, government-funded community programs. So they are actually divided into level 1, 2, 3, and 4. And what it means is that people in level 1, they can actually have 2 hours of help in a week. So it may be cleaning, it may be help with appointments, it may be help with the shopping, and it may be help with personal care. And then there's a level 2 that has got I think 4 hours in a week. Then level 3 that has got around 6 hours, and level 4 that has got around 8 hours. So basically, what you need to do is, if you think that you need extra help, you can actually request to My Aged Care. So if you search online, there's a My Aged Care number. It's a 1800 number. You give them a call. They will send an ACAT assessor to your home, and that ACAT person will sit with you for nearly an hour, take the whole history, will try to find out what are the needs, and then give you approval for the package. And with that package, whether it's level 1, 2, 3, 4, depending upon your care needs, you can actually contact service care providers. They will give you the details of the service care provider in your area. ACAT people will give you the whole details. And then you give a phone call to few different service care providers and negotiate with them, because for last 4 or 5 years, you can actually shop around. So let's say you're getting funding. Let's say you're getting level 4. You may be getting around $40,000-$50,000 per year from government, and you are the owner of that grant. So basically, you when you talk to the service care provider, you negotiate with them and ask them what extra services can they provide. And because there are a lot of service care providers in the community now, they can actually give you some extra hours. So that's what I would suggest. Unfortunately, in our Indian community, do not have too many service care provider that caters the need of Indian community. But I think this is something which we need to look into in future, so that we can actually develop our own services for our own population and our own community.
Dr. Kawalji, thank you for that information. Just to clarify that to get those community services that you mentioned, we have registered a lot of people on My Aged Care. The people who are on the social security, they have to pay minimum, like 85% is paid from the My Aged Care and 15% they pay from themselves. But the people like some of us who are on self-manage or their superannuation, they have to pay a very high rate, because we had some people who contacted us and we noticed that for the same service for per hour, for example, a person on My Age on the social security pays $15, but for the same person, for self-manage or a person asset, it's all asset related, you might be paying $60. Now for that one, another thing which for Asha Australia Foundation, the reason we didn't get provider number is that because we don't have resources to manage it. But we will be looking at is like in like a brokerage system or in partnership. We have been approached, but it's just a matter that we didn't have human resources. And Dr. Valanju and Dr. Sundar knows that we've been looking at it. We had literally stopped our application because when we looked at, you need all those sort of personnel and the investment to do that. So you're very right. We need to have, people do contact us. When they say we want somebody Indian with the culturally appropriate care. So we do hope that if community comes along, and that's where we want our community to come and support us, so that we will from Asha at least provide them or link them in collaboration with other services, and they can have Indian culturally appropriate care. So this is possible. We can do it and we want to do it. What stopped is our lack of resources, human and financial both. So if community really wants it, we don't want big nursing homes. If in fact, personally, and Dr. Valanju and Dr. Sundar knows, we will not have nursing home. We rather have small group homes, which is home-like atmosphere. We want to do it. We will help them to do it. If only our community comes along and helps us, and then the cost will be less, much less than what the self-retirees or the people who have worked like us for 45 years, they cannot access any of the social securities. It's possible, we can do it, only if we do it together.
Yeah,
I thought I mentioned that point.
That's
Was
well said, madam. Well said. Absolutely. Well said.
Can I add one more thing before I forget about the falls? I forgot one very important thing which need to be looked into, and that is diet. And because a lot of people, they get muscle weakness, and because they are not doing exercises, they are not eating much. And because of that, they lead on to the wastage of the muscles. So that is another important thing, especially like, if you got if you're having falls or you're getting frail, you go and see your GP and ask for a referral for a dietitian. So that dietitian can actually look into your diet chart properly and recommend what to eat and what not to eat. And they can actually recommend dietary supplements as well.
And we are very
Yes,
lucky
yes.
to have Mobina, who's a nutritionist. And so we'll have one of the sessions. We're very fortunate, we have in-house as well. I mean, definitely go and see the doctor. But
If I can add quickly one tip. So basically with the muscle mass, of course, with the exercise, if we can increase the protein intake, and for vegetarian, mostly it's a dal and the soya and the milk. So the milk, what they can often, elderly people can't have a milk as easily. So they can actually, either they can have in the form of yogurt, or if they can tolerate milk and the full glass is not possible for them, they can have a half a glass and put extra tablespoon of milk powder. That's easy to take it down. So and the nuts, they can add nuts powder in their meal. All the meals they prepare, they put nut powder in that, and soya. Yes.
Thank you.
One more thing, Nobina, you forgot.
Yes. There's a lot of things I might have forgotten, but yeah, just
How
top
about
of the
cheese? The cheese.
I'll ask Dr. Kenwal Singh, is coconut oil is good for dementia or not? Let's see, Dr. Kenwal Singh.
There's a lot of debate, lot of research. We don't have a proper conclusion whether it's good or not. But I don't think that there is any harm in taking coconut oil. It's natural, and basically, like, Indian community has been using it for ages. So, like, whole South India use coconut oil in their basically dishes everywhere.
Yeah. With the coconut oil, what is happening? It is a saturated fat, but what research has found, this particular saturated fat does not have the same impact as the other saturated fat, which comes from animal fat. So it has a different function in our body. So that's why it's safer to have. Of course, too much amount is still not recommended, and the palm oil as well. So not recommended too much, but some amount of coconut oil is okay.
I probably would suggest and prefer is eating instead of oil, coconut oil. Instead of that, fresh coconut is much more better.
No. I have 1 teaspoon of plain coconut oil from the natural chemist. We take for the last 3 years now. My sister takes that too. Whole family take 1 teaspoon of coconut oil in empty stomach in the morning. Definitely proves that reduces dementia. I can tell you that.
And
Not
you can do
coconut,
the
just teaspoon of coconut oil.
you can cook with coconut oil as well if you like.
Yes, right. You can buy that from the Indian shop or Filipino shop. The one in the Philippines is much better.
Dr. Sundar, so if people have cholesterol, so is it good for them? Coconut
Yes,
oil?
that's right. See, 1 teaspoon does not increase cholesterol. Coconut doesn't increase cholesterol whatsoever. No, look at Kerala. In Kerala, 90% of people eat coconut. The percentage of dementia in Kerala is 0.2%.
Thank
Dr.
you.
Kimball Singh probably agree with me. Dr. Kimball Singh probably able to tell us more about this when next time.
Any other questions, please, or we hand over to?
Just a small comment can I make?
Yeah, sure.
Doctor, I was advised to have bar in the bathroom. So I put small, racks and put whiskey on that. It is not this type of bar. I do not know what is the bar he was referring to, but anyway, that's what it is.
Railing.
As long as you're not falling, it's all
That's
good.
I agree with that, Dr. Chawla. I rather have the real bar with all the whiskey and everything in the bathroom, and spend, or maybe have the spa and put it next to it. So thank you for that suggestion. It's really excellent. That sounds good. If we don't have any questions, can I mention and ask Dr. Valanju, is one of the directors, to give the vote of thanks. And before I say that, I'm thankful to Dr. Kawaljeet Singh, Dr. Sundar, and all of our friends who join, and Mobina and Poonam for looking after the Facebook as well. It's a team effort, and we're trying to tab on to new technology, and we all learning. And thank you very much. And here we are, Dr. Valanju, all yours.
Thank you.
You have to, yeah, thank you. You have to unmute.
Unmute. Please
Dr.
unmute.
Valanju, you have to unmute your audio, please.
Probably host can do it.
Yes. No.
Okay, now can you hear me?
Yes,
Yeah.
yes,
Yes.
yes, we can hear you now.
Yeah. Okay. Well, thank you, Bijendraji. And thank you, Dr. Keval Singh. Falls is causing Australia a lot of money. As you probably know, falls in the old age are on the increase, and we need a lot of help. And Australian population is also aging. So of course, the number of falls are going to be on the rise. And these sort of talks are going to help us a lot, how to prevent the falls and things. And I think that was very, very essential for us to promote prevention of the falls and factors that could lead to the falls and the further problems that can arise from the falls. So thank you very much for a very informative talk, and we hope to go from these in the future, not only about prevention of these, but also get more information to the people as to how to start right from the young age to make sure that we don't come to this stage where we have to really start looking for answers. I'm sure Dr. Keval Singh is aware of that, and maybe in the near future we would like you to come and enlighten us on that.
Yes,
Well, thank you very much.
my pleasure. Thank you.
We hope, Dr. Kawaljeet Singh ji, that we can call you back again, and thank you for your ongoing support. I must mention that our next session, which will be on 5th of September, is the follow-up Dr. Bishan Sim's talk. This is the exercises. He's organized a physiotherapist to have this session, which you can show you. If some of you remember who were with us, that to show that's your, and it will help with the fall prevention and for the spine and the pain. So that will be in a fortnight, will be done. And the other important event, please, we send you the link, is launch of the Elder Abuse, our short films, which a lot of our people here are the one they did the acting, and it's we can say it's locally made by local people, our Asha family. So we'll be sending you the links, and hope to see many of you. And thank you very much, and we appreciate. Let's give a big clap to cheers to Dr. Kawaljeet.
Thank you. Thank you so much.
Thank you.
Thank you.
Having me.
And thank you to all the Asha family and our supporters from the Lions Club as well. And other people who we can't see, they are with the Facebook. Thank you for your support, and we look forward to many more of these. Thank you very much. Thank you, Mobina, for holding,
You're welcome.
and Poonam trying to link to Facebook. Dr. Sundar.
contact Dr. Keval Singh.
Thank you very
It's
much.
my absolute pleasure. Bye, everyone.
Thank you
Bye
very
for
much.
now.
Thank you.
Bye.
Thank you.
everyone.